Hello, good morning, and, s- and servus and early, and good morning. It's nice to be back here at ZeroCon 26. Today we will showcase how institutions and grassroots groups in Asia and Europe make environments accessible beyond legal mandates in all sectors. My name is Rachel Dubin, and I'm a researcher in the United States Congress. I am representing myself. All opinions and views I express today are mine and not those of my employer. I'm a white woman who's nearly 50 years old, and I have short brown hair, brown glasses, and I'm wearing a gray shirt and a black sweater. And I am deaf, and I hear with cochlear implants and speak 6 languages, including French and German and Austrian. I do not sign. Last year, the Americans with Disabilities Act turned 35. This year, the Air Carrier Access Act will be 40. The EU has just got the European Accessibility Act. Accessibility has been indispensable to me. Because of live captions in my iPhone, I can talk to anyone. Because Zoom and Teams include user-activated captioning, I can function in my job and participate meaningfully in video meetings. And thanks to my cochlear implants connecting to my phone via Bluetooth, I can hear the GPS directions on my phone without needing a connecting device. Flight attendants are sensitive to my communication needs as a deaf person, yet they still give me rail cards and wheelchairs. And right here in Vienna, I am continually impressed by the accessibility that did not exist when I first came here in 1995. Tactile paths, a tactile version of Klimt's The Kiss, and museum videos subtitled in German and English. How far, how very, very far we have come since the 1990s. But there is still so much more that needs to and can be done all over the world. Now to my right are Lukáš Hasnader and Radek Pavlicek from Masaryk University, Tyrese Center, presenting on Theseus, and Zandy Wang from the Next Gen Accessibility Initiative and the Rhodes Scholar at the University of Oxford, presenting her work, Case Studies, and the Next Gen Accessibility Initiative, and Roman Venner from the Geodetic Institute of Slovenia, presenting on the National Accessibility Map, and finally Kavita Ilangovan from the National University of Singapore, presenting a replicable model for accessible programs in libraries and other public spaces. Now each of them in turn, and this order, will briefly present the project, and then afterwards we will have about 10 minutes Q&A.
Thank you, Rachel. Hi, everyone. I have to say, it's a real honor to be here at Zero Con for the first time for me. I'm Lukáš Hasnader, my colleague is Radek Pavlicek, and well, I'm sure many of you know Radek for his many achievements in accessibility over the last 30 years, but Today we are here because Radek founded our project actually, and he's trying to get proper slides on on the screen. But well, our project is called Theseus, and we describe it as a one-stop shop offering professional training and accessibility audits and resources to learn from as well to improve digital inclusion for everyone. And that is exactly what we try to do in our everyday work, because having policies themselves is one thing that is nice and important, but another important thing is to have people that make sure that these policies are being implemented in practice in a way that makes sense, and that is what we are trying to do. Do we have the slides? No. Never mind. Okay, so we're doing with, okay. Well, we've been founded as a project in 2022, but we have over 25 years of experience, because we are a part or our background, our roots, our grassroots lie in Masaryk University in the Teresias Center, and Teresias has more than 25 years of experience making higher education accessible to students with disabilities. So we wanted to bring this institutional knowledge plus awareness of modern international accessibility standards. We wanted to take this all and bring it to the larger public and private sectors. So that's why we launched our project, TESOS. Now, what do we actually do in our daily work? We focus on practical accessibility. So it's not just about laws or policies. The important thing for us is user-driven results. So I'll explain that I think this is better explained when I say what is really innovative about us. The innovation about us, because I have not said it yet, I'm saying it now. I'm also blind myself. The innovation of this project is that virtually everyone in the team besides Radek is blind, or like very severely low vision, legally blind. So yeah, everyone except for Radek is blind. We're not just users, just beneficiaries of the service. We're not just the ones that have accessibility needs, but we're especially or also certified leaders. You know, we combine the authentic lived experience of users with disabilities with the actual professional knowledge, professional know-how, and I think that is the important part, because we are also certified users of either like NVDA screen reader experts, or we have also IAP certification. A colleague of mine has CPAC. Rest of us are preparing for WAS or WS this year, so we're working on that as well. But besides all of that, we're all people who are blind or visually impaired themselves. We need to use the services that are not accessible. We know that a lot of digital services today still are more or less inaccessible, hard to use. That complicates, you know, our lives as people with disabilities, and that's where we step in. Oh, okay, where we step in and what we do. I'll leave the rest to Radek. Thank you.
Okay, thank you, Lukáš. Hello, everybody, and I will briefly continue with the demonstration of some numbers. You know, Czech Republic is a rather small country, about 11 million of inhabitants, so these numbers reflects the size of the market. So we delivered more than 250 audits, accessibility audits. We trained more than 4,000 participants in our courses and webinars, and we also created and published more than 150 educational materials, since we think, and our mission is that the education is one of the pillars when you need to succeed in the accessibility field. Here are some real-world examples, sort of case studies, what we achieved so far. We collaborated with some public services, for example, a web portal for your taxes when you need to deal with this. In the field of art and culture, we collaborated with Canon, with Brno Zoo, and in terms of media, we collaborated with Czech television or Czech radio and helped them to deliver accessible public broadcasting services. Regarding the life stories, Lukáš, who is here with me, is a perfect example where you can move from an undervalued talent to a certified specialist, where his expertise is, let's say, a combination of his lived experience with disability and his, let's say, professional background and education skills and competitions. Regarding financing, now it's more or less 50-50 what we are able to earn and what we get from our, let's say, sponsors or supporters. And let's briefly describe what we'd like to do in the future. We'd like to focus on strategic partnerships, on delivering more education and tools which can help people to enter the accessibility field, since based on our experience, accessibility is still being considered as something what's complicated and people can struggle with. So we'd like to lower the bar and open accessibility for everybody. So that's the brief introduction of what we do, and if you would like to know more, just get in touch and we are happy to discuss with you. Thank you very much.
Okay, Sandy. Sandy, you have the floor. Go ahead.
Okay, while the slides are getting up, I would like to introduce myself. My name is Zandy Wong. An image description of me: I am an Asian American woman with long black hair, and I'm wearing a black blazer and a blue dress. And today I'm here to talk about my organization, the Next Gen Accessibility Initiative, and how we've collaborated with public sector and nonprofits to help teach youth about digital accessibility and disability inclusion. And some other background on me: I'm currently based in the UK, but I work broadly between the US and the UK and globally to help improve digital accessibility for schools around the world. So how did I come up with the idea of Next Gen Accessibility Initiative? I'm hard of hearing. Rachel and I have known each other for a long time because of our background, and it's a wonderful opportunity to be here and be on this panel. But I started undergrad at Johns Hopkins during the pandemic, and it was really difficult to get accommodations, and it seemed like professors were just really busy with everything else. And so there was a gap in accessibility education for professors and ultimately for youth. And I felt like youth, secondary school students, primary school students, weren't really being taught about digital accessibility and disability inclusion at that level. And so I wanted to fill that gap and make the road easier for other students like me. So I founded Next Gen Accessibility Initiative by reaching out to Gen Z nonprofits run by Gen Z and really working with them to offer free consultations related to digital accessibility so that it could fix gaps in their digital accessibility related to their social media content and the digital education that they were putting out. And so I've been working on this project since 2021, and the results have been kind of exponential. We've helped over 200,000 students across 119 countries gain access to accessible education. We've hosted a lot of workshops over the years, both virtual and in person. And I've had the opportunity to create toolkits about digital accessibility and disability inclusion with Johns Hopkins School of Medicine and the US Department of Labor. And so the rest of this presentation is just going to focus on how we've been able to engage youth and really being part of the co-designing process of what digitally accessible public services mean for them, and some examples with a nonprofit I worked with in Korea. And so this case study was with the CAPE Youth Working Group in the US Department of Labor. For my US folks, that'd be ODEP. And it was really fun working with them, really learning about their issues and seeing for next steps moving forward. So the problem that they had were they were unsure about how to engage youth with disabilities in governmental processes. Often I think youth participation can be kind of seen as a little bit tokenism. They can be asked for their opinion, but not given much back. And so I worked with them to participate in working groups that provided perspectives of youth with disabilities and helped them co-create an accessibility toolkit to teach youth about digital accessibility. And so this process was really just twofold in really engaging with youth with disabilities, having their input throughout the way, and having them have meaningful takeaways from the process. And it was a really great project to work on. And then the second case study I wanted to highlight was an organization I worked with in South Korea called SteadU. And their problem was that they wanted to build accessible STEM education for South Korean youth with disabilities, but wasn't really sure where to start with. And different countries have different perceptions of disability. So I think some of the challenges we faced were related to, one, language barrier. I do not speak Korean, so that was a lot of Google Translate and English going back and forth. And two, just cultural gaps on what digital accessibility is. And so it took a lot of back and forth meetings and really working with these teams to understand what digital accessibility might look like in a context outside of the US and Europe. And the result was that we were able to create accessible STEM education for 5,000 youth with disabilities. So these projects take time, but when they actually work, it's really exciting to see the impact of it. And so some reflections and takeaways from my experience working with the Next Gen Accessibility Initiative is that youth with disabilities have unique perspectives from their lived experiences that can add to digital accessibility consoles. They have lived experiences in healthcare and education, and I think youth with disabilities do deserve a say in the policies and programs that are being created for them. And engaging with youth with disabilities includes meeting them where they are at. I'm lucky enough to be part of this conference, and I wouldn't have got here without the financial support of my university and Zero Project helping to fund that. And so youth with disabilities are often marginalized in so many ways, and so providing not only mentorship, but financial support to get to conferences such as like these and to get their foot in the door ensures that their perspectives are heard and that the programs and policies are inclusive for them all. And so I want to give a huge thank you to Robin for inviting me and my friend Yardena, who was a past speaker here, for also including me in this conference as well. Thank you.
Thanks, Sandy. And now we move back to Europe with Roman.
Yes. Dear audience, dear participants, I'm coming from National Geodetic Institute of Slovenia. My name is Roman Renner. I'm aged 60. Normally I wear glasses and I'm more than 1 meter and 90 centimeters tall. Today I will speak about enabling multimodal mobility for persons with various disabilities, a national accessibility map co-created by users, NGOs, and local governments. The next, please. Okay, I have here. This one. Okay. Let's say something about the Geodetic Institute. The Geodetic Institute of Slovenia was founded in 1953 and is leading public institution for geodetic, geoinformation, and cartographic research and development in Slovenia. The Institute has specialized team who intensively develops the field of multimodal mobility for persons with disabilities more than 30 years. We are especially proud of award from the International Cartographic Association Award for Excellence in Cartography for Tactile Maps and Innovation Award from Government of the Republic Slovenia for Digital Mobile Atlas of Ljubljana Tactile Maps for Orientation. The project includes 5 vulnerable groups for which standards have been developed. Includes blind and partially sighted, person with reduced mobility wheelchairs, deaf and hard of hearing, elderly people, and person with intellectual disabilities. First, we developed standards on the state level and support for state policies. Combining knowledge of 2 areas, technical and social, provides great added value. We have a bottom-up approach, and we have 2 simple rules: nothing about disabled people without disabled people, and expertise, integrating different professions. The project has been running for 10 years. We have really good cooperation with the municipalities. The great response of users confirms the useful value of the project. Currently, 130 municipalities are involved in the project, along with more than 1.7 million inhabitants. It's approximately 80% of Slovenian population. What gives a project its strength and effectiveness? That's definitely connectivity and cooperation amongst three partners. Then it's ministry and state institutions who bring out standards, then 24 national disability organizations, and municipalities and partners. Most of the data is collected in the field by disabled people themselves. The process, preparing and collection of data is entirely digital. In the picture we see Stoyan in a wheelchair collecting data in the city of Velenje. In the data we have more than 50,000 objects. Stories of the field work during data collection. We see Blaž and Urša. Both are muscular dystrophic, collects data in the field in the capital of Ljubljana. The next slide shows us Tony, who is a blind, perform an accessibility check to the municipalities' websites. Project results. It's a public spatial accessibility viewer, and all the data are free of charge. So you can go to the www.dostopnost-prostora.pk and you can get all free data. The public viewer allows us to review obstacles and plan a safe route. Project results and impacts. We can produce action plan for the elimination of barriers of the municipalities and public institutions. And then a database allows us to develop new services and products such as web map, printed accessibility map, navigation on smartphone, and etc. Project results and impacts. We permanently conduct regional workshops with users through the country Slovenia, picture 2 in the middle. We actively carry out promotion on the national and local levels to raise awareness among the population. Picture 1, the President of Republic Slovenia, Dr. Nataša Pirc-Musar, talk about our project. Picture 3, the TV broadcast Good Morning Slovenia, also we talk about our project. There is only one space which belongs to all of us. The project solution is standardized and very simple, so therefore is quickly transferable to other countries and environments. Thank you for your attention.
Now we move from Europe to Asia, to Singapore. You're up.
Okay, hello everyone, good morning. I'm Kavita. I am from Singapore, from the National Library of Singapore. So I am an Indian female, I was going to say girl, but Indian female, and I have long black hair. So in Singapore, we have about 26 public libraries, and in 2003, we decided that we wanted to start up introducing services for persons with disabilities, and we started a pilot in one of the new libraries that we launched. So in 2023, when we opened the new library, which is called Punggol Library, we introduced a few new services for persons with disabilities. So we have accessible infrastructure, we'll introduce accessible collection, accessible technology, and membership services, a new membership service that was for, it's very special for the PWDs. So when we talk about the membership, certain things that are unique for them would be they have a longer renewal period, a longer loan period, and they can also reserve items for free. So these were a few added features for people with accessible membership. And we introduced things like, if you look at the photos, we have accessible collection, and we have a calm pod for persons with autism. Actually, in fact, it's for everyone, but this was specially catered for persons with autism. We have the accessible technology, a toy library, as well as a borrow and go book borrowing station. So it is, other than using the mobile app, we also have a very unique one, which is a borrow and go. It's more like a tunnel where, say you're a wheelchair user, you don't need to move the books, you can wheel yourself into the tunnel, and it will detect the books, and you can borrow it and wheel yourself out. But one of the gaps that I wanted to introduce, and the solution that we introduced for this Zero project, would be bridging the gap between the persons with disability as well as the general public. Is how are we going to get them to integrate so that everyone can come together? And also to look at ways where we can support their living. So first one is we do have a lot of programs in the library. And one of the things that we wanted to look at would be programs that are led by persons with disabilities. One is because they have so much to offer, and we wanted to showcase what they have to offer in terms of their skills and what knowledge they have to share to everybody. So that is one of the things that we have introduced, programs by persons with that are led by persons with disability or co-led. And we also have exhibitions that showcases their artworks and products. We not only just showcase it, we also try to see how people could actually buy these items if they're interested. So along with the displays, there's also a QR code. So if anyone's interested, they can scan the QR code, which links back to the organization, and the person can just buy whatever item they're interested in. Next, we introduce accessible programs. So the accessible programs would be, we try to cater to the different disability groups. So for the deaf community, what we did was we introduced sign language interpreters, and we have live captioning. This wouldn't be for all the programs, but there are select few programs that we are looking at that would interest the deaf community. Next would be persons with autism. We have social stories. So like I was saying, we have about 20 over libraries, and we have social stories for all of these libraries that are up on our website. So if anyone's interested, they can have a look at it before they come and visit us. And we include schedules for any of the programs that are catered for persons with autism. And for spaces, for wheelchair users, then other than having bigger aisles between the shelves, we also look at maker spaces to ensure that it's not a trip hazard or for anybody. And also, the power outlets are not on the ground, they're all hanging from the ceiling so that it doesn't affect them when they are moving around the space. And for persons with visual impairment, what we try to do is to send them the presentation slides in advance so that if they want, they can prepare themselves to know what is ahead before they come in for the programs. And what we have been doing is, like I was sharing about the accessible membership, to introduce it to the PWDs, we even got a PWD to help us to do a little comic so that it's part as a marketing effort. So that is one that is done by a person with autism. He helped us to draw the comic, and we have been using that to share it with the community. This is an example of a program that was conducted by two persons with disability. The lady holding the mic, she has visual impairment, and the man that's on the wheelchair, he has mobility issues. Just a fun fact, they are both, they're a couple, and they've been doing quite a number of programs for us. So in terms of achievement, so like I was sharing, we started off in 2023, and we have progressively been having more programs, and we've been having more PWD participants coming in. But more importantly, the thing that I'm more proud of would be the number of programs that we have worked with the PWDs to lead the programs itself. So if you look at the numbers, they have increased over the years, and which also means that there are a lot more general public that get to see what the PWDs have to offer. And what we are planning for the future would be, of course, I would like to have a lot more programs that are led by the PWDs themselves, more exhibitions so that people know a lot more of what they have to offer, accessible programs so that there'll be a lot more programs for persons with disabilities to participate in, And we're also looking at how we can expand this to all the other libraries as much as possible. We have 20 over, so we're looking at expanding the accessible collection as well as the infrastructure as much as possible. So I hope this inspires you all to adopt some of the accessibility features if it's possible in your libraries. And if you're interested to know more, you can come and reach out to me. Thank you.
Thank you, Kavita, and thank you, everyone. So now we have about 10 minutes or so for a Q&A. But if there's no Q&A, I've devised a question for the panel. But first, let me open it up to questions, and if you would identify yourself and where you're from, and use the microphone, please. Has anyone any questions? Okay. Okay, we will move to a question that I've devised for the panel. So, how do we go from project to disability leadership? And in other words, how do we create a culture where accessibility is baked in? And then once you can take the question as you wish. Sure.
So to make sure I got the question right, it's how, when I go from project to project, how does accessibility get baked in?
Sure, I can repeat the question. How do we go from project to project, you know, to actually implementing, you know, the disability leadership? I mean, we've got all these projects. And then, how do we ensure that disability leadership, accessibility, they're baked in from the beginning?
So I primarily work with youth nonprofits run by Gen Z youth who are often a little bit new to this thing and just trying to figure it out. So when I'm working with them, a big thing about it is, one, creating tools that they can refer back to when I'm not around to ensure that their content is digitally accessible. And so that's through toolkits, through videos. And then it's often, I think I'll often encourage youth nonprofits to have some sort of representation of a person with disability in their leadership. And they're quite receptive to it, and I think that's really important. So it's a matter of, one, following up with the youth organization, two, leaving tools that can create an impact long after I work with them, and three, ensuring that leadership is embedded in their core values and disability inclusion is embedded in their core values as well.
Okay, I'll share for the library context. Instead of going from project to project, we have created a team that looks at accessibility services. So this helps when we are looking at all the different services that the library has to offer. There's at least a team that is bringing all this together. Hopefully in the future, when everyone, this is a little bit more steady state and everyone has this in their blood running naturally, it wouldn't be, maybe we will not need a special team to look at it. Maybe it would be something that is so natural that everyone will think about it in every area that they are working in. So maybe in the future, but at this point in time, we do have an accessibility team that helps us. So we don't really do project by project. So it is really a team that leads this.
Okay. I think it's really important if the founder themselves is not a person with a disability, I think the important thing is to really just live in the community and get to know the needs of the, you want to work for a certain demographic, you want to build accessible projects that should, ideal scenario should be like, the projects should evolve one from another. So you need to, if you want to work for a group, you need to get to know the group. I mean, when I started working with Radek here in the Theseus project, when he approached me and was like, yeah, I'm kind of looking for professional colleagues, you know, who know what they're doing and actually are part of the community. Do you want to work with me? If I didn't know who Radek was, and if I didn't know that he was genuine about it, that he was actually caring about the real people and real needs and not just some fancy, sexy claims on paper, I don't think I would have said yes, you know, like, because if you know that you have, now I'm speaking from my own point, as a person with a disability. If you know that you know something, you have some knowledge, maybe some expertise, you also have some pride. And you don't want to work just for anyone if it doesn't make sense to you. So if I was approached by someone else who didn't have this, who wasn't so renowned for really working with the people, for the people, with us, why should I, as a blind person, want to work in a project that doesn't care? Like, if they don't care, why should I care? That's the whole thing, I would say. Thank you.
Okay, my project running 10 years. I can tell you about it. We are an institute which is project financed. We have a good team, last 7 years. And of course, I think that's very important, the long-term goal, not only for one project, one package. And it means there it's first that we produce standards for whole country. If the Google Maps navigation will have each country their own standards, or each village there will come to the end of the point. The second, it's definitely long-term partners, so that the partners who have the same goal, so that as I showed you before, there are 3 partners: the state, the 24 national disability organization, NGOs, and we have contracts with the communities. The system, when we built up, it would last 5 to 6 years, because you cannot be so fast. And after, let's say, half of the communities signs the contract with us, agreement, then all the others would like to come. And then the last thing, but very important, is financing. So we are yearly financed, so that not say so, maybe the state is the worst partner of this REIT chain, but we press every year to get money. So sometimes we wait 3, 4, 6 months, but afterward we go ahead, so that all these components, and of course that the different professions work together. And then, because we are only technicians, and in my case of the project, 30% of the, let's say, energy we put to promotion and to spread the knowledge between partners first, and then to the community, so that without promotion and without share the knowledge, is impossible to build up the project. So that's my answer. Thank you.
Yes, thank you. So we have about 15 minutes left, and have we any? Yes, I see someone's hand.
Hi, this is Ted Drake from Intuit. I have a question that more going towards Roman, but might be for others. You're working on a project, as you say, is standardized. And it's also a project that's been done probably 100 times in 100 different locations. But unfortunately, a lot of that data gets done and then it gets lost. And so one of the questions I have for you is, what do you see as the future of all of these accessible mapping projects coming together and actually getting supported by Google Maps, Apple, OpenStreetMaps, so that we have a universal solution?
Okay, thank you for a question. It's the core of the business, so that the 80% or 90% it's infrastructure. That means that the costs of the data means, let's say 90% of the cost. So we would all like to, let's say, develop programs and navigation, so, but without the stuff of the data, it's impossible. Our process is such that we collect as much data as in the environment from the government, from the community, and we prepare, as you saw on the picture before, we prepare 70% of all data in the office, so that when the wheelchair person goes to the field, it has a tablet or has a smartphone, and everything is prepared to add the data, which means approximately 30% of the system. And because the data is collected by the wheelchairs themselves, then they really know the environment where they live every day. So that in the same way we update data, but we have all data we collect from different ministries, because there is a lot of data, and of course from the local communities, as much as give us information on the field. Yes.
Any other questions from folks? Well, there's something I want to ask Kavita, and I was very intrigued by the programs for the deaf and hard of hearing, and that you have sign language interpreters. Are you able to hear okay? You're hearing okay? Yes. Okay. And you have also live captioning. Now, are the interpreters and the captioning provided from the beginning, or are they, I mean, as a standard, or does somebody have to request those services for the program?
Okay, so like I was saying, we started in 2023, and we don't have it for all the programs. So what we have started off with would be, we would usually reach out to the deaf organization to say, okay, at this point in time, what we do is we would say, okay, these are the programs that we are offering, and then we would have the sign language interpreter as well as the live captioning. But what we hope to do in the future would be, because we have so many programs, we would really like to reach to as many deaf individuals as possible, and they'll probably have different and varied interests. So it would be nice if in the future, it would be for them to tell us, okay, these are the programs we are interested in, and then we can offer the provisions necessary. But at this point, it is usually a select few that we already have, and then we tell the deaf organizations that these are the programs, and then we do that we provide whatever is necessary. Yeah, so step one, we still have quite a long way to go to reach where we have it for all our programs. Yeah.
Thank you, that works. Yes, thank you. So, so I think we still have a couple more minutes. We do. I think this is a very interesting topic. And we've heard today about developing maps in the Czech Republic, in Czechia, and also in Slovenia. We've heard about things that help us navigate. We've also heard about website accessibility. We've heard about library accessibility and the programs being developed in Singapore. And this gives me hope for the future of accessibility in public places. You know, that goes just beyond what the law says. And this helps everyone. And also the captioning, I should add, the captioning and the things that talk, and the directions that talk. It helps so many other people than just people who have a disability or who identify with that. I'm deaf, but I said earlier, I use the GPS on the phone that talks to me. And why? Because it plugs into my cochlear implants. It forces me to listen to to the directions. And also, it's a safety thing that I don't have to keep pulling my phone out and looking at it for directions. So this is kind of an unusual use case. You don't think of deaf people using talking GPS, which helps blind people. But it helps me. It's awesome. But this is not something we envisioned in 1990 in the United States when we passed the ADA. This goes beyond that. And it's really emotional for me to be here as an American, knowing the situation that's happening. And all I can say right now is thank goodness that the ADA still stands for now, and that we are able to do this, and that there is commitment in the rest of the world for inclusion, for accessibility. And I hope that that continues. And so with that, I would like to thank all of the panelists for their efforts this morning and for coming to Vienna. And thank you again, and enjoy the rest of your day.